Welcome, everyone, to the MPP Michael Tibollo Transitions Community Town Hall. My name is Belinda Marchese. I'm the Executive Director of Hospice Vaughan. It is with great pleasure that I am your moderator for today's discussion with a wonderful and special panel of guests. Today, we're here to talk about transitions and how we're all being affected in our community around COVID-19. It's with great pleasure that I first introduce Minister MPP for Vaughan Woodbridge, Michael Tibollo, to do a warm welcome and introduction for today's event.
Hello, everyone. Pleasure being here with everyone this afternoon. As many of you know, I'm the Minister responsible for mental health and addictions for the province of Ontario. And one of the things that's extremely important to us is how we're dealing with our mental health during these very difficult times. So I look forward to the discussion that'll take place this afternoon with everyone. And I look forward to answering some questions for you as well. Thank you.
Wonderful. Thank you, Minister Tibollo. Today with us was to be our Mayor, Mauricio Bevilacqua, and it's with great pleasure that I share some comments from him. He had hoped to be with us today. So I'm going to read something that he sent to us for the community. I would like now to provide greetings on behalf of Vaughan's Mayor, Mauricio Bevilacqua. First, I'd like to thank each and every participant in today's virtual town hall. I continue to be encouraged by the coming together of thoughtful individuals and stakeholders to identify and respond to the challenges facing our community today. The current situation has thrust change upon each and every one of us. No individual, no group, no community, no country can escape the effects. This is precisely why this virtual town hall's theme of transition is one that ought to be explored, discussed, and indeed facilitated. I am very grateful for your contributions in this regard. The City of Vaughan has been a leader in combating COVID-19. Throughout this pandemic, we have ensured the quality of services are delivered to families, businesses, and all citizens. Vaughan was the first city in Ontario and the first municipality in York Region to declare a state of emergency on March the 17th. Our priority remains health, safety, and well-being of everyone that lives and works here. I established a members' resolution to establish the Ready, Resilient, Resourceful Committee of Council with a mandate to report on issues related to the city's ongoing response efforts. We are developing a fulsome economic recovery plan to transition municipal planning from pre-COVID-19 to post-COVID-19. It will focus on securing Vaughan's place as the region's largest employment center, enhancing key strategic economic drivers like our downtown core, manufacturing, and logistics, the health and tourism industries, as well as leveraging public spaces for community events and the arts. I remain committed to working closely with the provincial and federal governments as well as members and stakeholders in our united mission to defeat COVID-19. We have done much. There is no question about that, but we have much more to do. These are indeed challenging times, but by coming together in the spirit of cooperation, I am confident that we will emerge stronger. I would like to thank Associate Minister, MPP Michael Tibollo, for hosting this gathering of the minds to help chart our course towards recovery. Stay safe. Thank you. So I welcome back Minister Tibollo to officially open up our town hall forum, and I will introduce our panelists from there. Thank you.
Thank you, Belinda. And the words of the mayor are always very inspirational. So I thank him for not being able to participate, but at the same time sending us some words of encouragement. The pandemic is something that we work really hard as a government to ensure that the health aspects are addressed as best possible. So the stay-at-home orders, the social distancing, the hand sanitizing, hand washing are all things that we've worked really hard with the chief medical officer to make sure that we do get control over the spread of COVID-19. But one of the things that we foresaw and we're seeing now much more is the impact on the mental health of people that are, at home isolated. When we started talking about distancing, we kept on saying social distancing. And I kept on saying, no, not social distancing. What we're trying to do is physical distancing because we don't want to be separated socially. We're social animals. We need to have contact with other people. And when you take a situation, the fear of the unknown, the change in circumstances that leads to not having an itinerary or a schedule to follow every day, people start to get nervous. And you think of the older population or seniors, and already isolated to begin with, now having to also be told you can't see your kids, you can't get together for your Sunday dinner, you can't go visit. Your grandchildren should not be coming to visit you because many of them are asymptomatic and they potentially could have something that will cause you harm. You take the young kids who are used to being around and socializing with their friends during the school day, after school, and the types of programs that we've had, whether it's dance, martial arts, activities that have kept the kids occupied for out of their 12 or 15 hours occupied, for a good chunk of that in social activity. Now all of that is gone, and once it vaporizes, what do these kids have left? We don't want them to be isolated that way because it causes them to look and into themselves and start to feel anxious themselves. Add on top of that they're not going to school and they're not with their teachers, and all of us have had to become teachers, some better than others, causing anxiety to the parents, but anxiety to the kids as well, that they're perhaps falling behind with their schooling. Then you've got the men and the women that have businesses that they operate that are finding that all of a sudden they're not able to go out and do their work, and they're seeing the little bit of savings they had that were invested into the business dwindling because there's no new income coming in. And women, not surprisingly, through the Angus Reid polls that were done a few weeks ago, they come back as being the highest percentage of people that are suffering from anxiety and depression as a result of COVID-19. So when you're a mom, you're a partner, you're a wife, you're a mom, you're the educator, you're the provider of so many different things, that weighs heavily on people. Compound that with the fact that we closed down places of worship so that people that were perhaps getting some assistance by speaking to their priest or to their clergy, their pastor, all of a sudden that's gone. And then compound on top of that the fact that so many people have died as a result of testing positive for COVID, and many of them being seniors, and the families not being able to grieve properly. So, when you're peeling off the layer after layer after layer of repercussions as a result of the isolation, you realize that we're on the cusp of a very, very complicated problem that's going to take not weeks, not months, probably years to deal with. And these types of encounters where we highlight who can come to the table to help. The frontline workers are not just the nurses and the paramedics and the doctors. They are also our clergy, the people that are working in the funeral homes that are at this point providing some of the only supports that individuals are getting. As a government, we've tried to be responsible and we've responded by providing supports virtually. But virtual supports work for many people, not all people. And this is why I'm very interested in our discussion today to see what else we can do and perhaps where we can start pressing some buttons to force the opening of certain services so that we can start building the resources we need to ensure that people have someone to talk to when they need someone to talk to. I think I'm going to stop there because I can talk forever on this topic. I'm very engaged in it, and I've got great people around me here that have a lot that can add to the conversation. And perhaps we can hear from everybody, and then we'll have a Q&A, a discussion about the different issues. So thank you all for being here.
Thank you very much, Minister Tibollo. Well, we have about an hour together, and we've brought together 4 different organizations to accompany this discussion with Minister Tibollo. During the next hour, for those that have a chance to watch us live, if you have a specific question or something that's on your mind, please be so kind to send a quick email to info, I-N-F-O, at hospice, Hospice, Vaughan.com. I am monitoring that email, and if the questions come through, we will make our very best effort to weave them into the discussions today. If not, we're also prepared to follow up with individuals based on the network who's present today to see who might be able to offer some support and assistance in regards to the questions that you have. So one by one, I'm going to quickly introduce some of the community partners. There are many incredible community and health partners that support our communities and our neighboring communities. While we would have loved to have everyone with us today, that wouldn't be possible. So we've invited 4 different organizations to be on the panel with Minister Tibollo, and one by one, I will introduce them to you. And they're each going to explain a little bit about not only who they are and what they do, but what their organization mandate is and how they're here to support the community. And as the minister suggested, then we're going to get into a roundtable forum where we're going to discuss some of the issues that have come forward by our community members. And we hope that that helps to build ongoing conversations and support for individuals. So firstly, please welcome Wendy Graham from Hospice Vaughan to share her opening remarks with you.
Good afternoon. My name is Wendy, and I'm manager of hospice services at Hospice Vaughan. The things I'd like to share with you about our organization is that we provide support for individuals who are coping with a chronic disease or a life-limiting illness. We also support their caregivers and their families and individuals who are grieving a loss. But that's not just what we do. We have a lot more when we focus on the entire family. We support the family with children's programming. We also support the caregiver with their own one-to-one counseling and group support. We have in-home visiting when we don't have COVID. And we have calls, and so many things have changed now with all the different restrictions that we've been moving very quickly to meet all the needs of our community in different ways. The counseling has continued. Our wellness seminars, workshops, and education are now online, such as navigating the healthcare system during COVID. So many changes that we want our community to be aware of. We've also got our emotional monsters and our wellness bingo and scavenger hunts for the families and the children that have so many things to process, not only on their own, but also as a group. It's very difficult at this time, and we wanted to make sure that we were there for our community as well as all different parts of the family. For example, we did have a single mom call, and she had 2 children. She has 2 children, and she is an only child to her parents, and her parents are in Europe. Her father unfortunately contracted COVID and died, and she was struggling to make all the arrangements, support for her mother, and everything from a distance across the ocean, and at the same time was very concerned about meeting the needs of her children who were grieving. She gave us a call, and we stepped up. We created a care program for each child, a connection for them, and we helped the mom and on her own get some counseling as well as some support. The arrangements she felt she could manage, but at the same time, knowing that she was doing the right thing was really important for her. So as we help our community and continue to be there for the whole family, we want to make sure that we're there and we support not only our community, but all the other agencies within our community as a compassionate community member. Thank you, Belinda.
Thank you, Wendy. Much more to discuss, and it's great to hear about the programs that each organization offers. And I always say to people, no matter what question you have or what need you have, just reach out to one person, because together we can make those connections, and even for needs that might be from far away as a distant caregiver. Next, I'd like to welcome Jasmine Fijo from CHATS, which is Community and Home Assistance to Seniors, for her to share a little bit about herself and the incredible work that CHATS does as well.
Hi there. I just want to preface this by saying I really, really appreciate the platform here today, not only to talk about what community stakeholders are doing during this time, but to have an open, candid discussion about the big elephant in the room, not only how it's affecting our community and our personal lives, but I guess together. So just wanted to preface that. So thank you, Belinda. Yes, CHATS, Community Home Assistance to Seniors. We provide supports for seniors and informal caregivers just to help them live independently at home through an array of different programs and services. And we continue to do this throughout the pandemic. Although it looks a little different and we did add some additional supports, we are still continuing to support our clients. So for example, our transportation continues to run. We are just limiting it to essential appointments only, as well as meal deliveries and grocery deliveries as well, and food bank boxes. We also have added help with groceries for clients who, through different ways of doing so. One is ordering it online and then we pick it up and drop it off, no contact delivery. Another way is we shop for it and then we also deliver it, no contact. And the last one would be transporting you to and from your local grocery store, but that's limited to clients who are 70 years of age and older. So the other thing we're doing here is in our assisted living buildings, they continue to run, but we have put in extra precautions for both our staff and our clients, as well as doing like screeners and PPE and keeping up with that. Our adult day programs have not been running since March, but we do have one in Aurora that continues to run for clients up to 10 at a time, especially for caregivers who are experiencing high levels of burnout. And our wellness supports, such as social wellness programs, continue to happen online, virtually, and over the phone. We are doing group and social programming, such as exercises with seniors, bingo, rosary. Telephone security, check-ins, and visits continue and have increased. Support for caregivers, which happens virtually as well as over the phone, also continue. That includes one-to-one supportive counseling, as well as support groups. Food security and nutritional supports for low-income seniors. We've received funding from United Way Local Love Food Supports and the Government of Canada's New Horizons for Senior Programs. This, although it ends in June 30th, it has been a great success. We have additional supports as well, such as Meals on Wheels, same program as always, but now we have no contact delivery. With new partnerships also help us to have a broader range of older adults and meet the needs of them we have FAF Motors FAF Motors, Highland GM in Aurora, Aurora Toyota, Newmarket Toyota, as well as in Vaughan, we have Peter and Paul's Catering and Events who donated to CHATS frontline workers. We have subsidized Meals on Wheels as well for seniors and other vulnerable individuals who are not able to afford the full fee of Meals on Wheels, as well as a food staples baskets, which is in collaboration with the York Region Food Network and Aurora Food Pantry. And our food pantry delivers specific cultural needs for those who are Chinese, South Asian, Iranian, and Russian seniors. We have enhanced safety protocols for both our clients and our staff, whether it be in transportation where you're having a physical distance, the windows are cracked down to allow for airflow, as well as enhanced hand hygiene and sanitization between clients. We also have provided PPE for staff who are continue to do face-to-face services for our clients. And we encourage our clients to wear masks, and they're all required to do a screener prior to your service delivery. All of this is made possible through the help of our community partnerships, as well as Emergency Appeal Fund, which is found on our website. All information on these services programs can be found on our website or by calling our number at CHATS. We continue to do this by supporting the efforts and needs of our vulnerable senior population safely at home during this difficult and worrisome time. All this is done to provide nourishing meals, drives to central appointments, and also to hear a friendly voice on the other side of the call. So thank you.
Thank you very much, Jasmine. Yes, CHATS has been offering a tremendous amount of support. And I should have mentioned earlier that June is Seniors Month. There is many things that we celebrate this month, including Pride Week, but the Seniors Month and the great work that senior-based organizations continue to do is very important. Next, I have a very warm welcome to Maria Rea, who's with Creating Alternatives, who joins us next. And we're really excited to have you join us and share a little bit about your organization and the work you do to support the community.
Hello, Belinda, and thank you everybody for being here. Creating Alternatives is a grassroots organization that was initiated by our funder, Phyllis Antone. With the support of families, leaders in our community, we have been able to fill the void that addresses lack of support for individuals with developmental disabilities. Our person-centered approach continues to break down barriers and provide unlimited opportunities for individuals to enjoy full citizenship in our community. Alternatives made the difficult decision on Tuesday, March 17th to close our program. Data showed that loneliness, anxiety, and feelings of depression because the individuals wanted to go back to their daily routines. Alternatives decided to once again create new alternatives for the participants, families, and staff. We revised and updated our programs, which included a virtual component. Our mission now is, you are not alone, and together we will get through this. We are here to talk, listen, and connect. The purpose of our program is to connect with family and friends, to continue learning, feeling a part of a community, and most of all, validate the feelings of unease. We provided iPads for the individuals who didn't have access to technology. We provided technology training not only to our participants, but to their families as well. We are now providing social distancing visits for those who do not have access to technology. We have also included social distancing programs. We update families regularly with respect to information and supports. And most importantly, we ask that they ask and you shall receive. If we can do it, we will provide it. We have encouraging signs as we continue to invest in services to adapt to this new normal. The community has also stepped up for Creating Alternatives. We were donated ice cream, which we then delivered to all our participants and families to stay connected. We have been provided additional supports to create activity boxes, which we are delivering to all the participants and their families. And this is all based on opportunities for shared activities. We are currently implementing a safety first phased reopening strategy. But most importantly, we wanted at Creating Alternatives to share a gift with all our fellow citizens. Despite these unprecedented times, we are reminded daily how fortunate we are to live in a country that has come together united to take care of all their citizens. Therefore, we're going to take this occasion to celebrate the endless opportunities that Canada has provided us in quality of life. Together with That's Showbiz, we reached out to First Nations poet Duke Redbird, and we will be performing a special performance for I Am Canadian. Our goal is to feature the many faces of Canada in our community. We have reached out to local leaders in hopes to have a video shared in the spirit of Ontario. And lastly, this will be a split fundraiser event for our organization and for also the Indigenous communities affected by COVID-19. I hope that the work that Creating Alternatives is trying to do will continue to create new opportunities, a sign of hope, and together we will get through this. Thank you.
Thank you very much, Maria. And for our panelists today, when you're talking a little bit about your programs, if you have the opportunity to reference some of the slides that you've shared, it will help us to match it up. If not, Mike and the Render Media team will continue to do their best in kind of sharing splashes of information so the audience can participate to things that we're following. I have to say, we've gotten a bunch of questions coming in, so keep them coming. Our information is info, I-N-F-O, at hospice, H-O-S-P-I-C-E, Vaughan.com. We've already had a slew of questions. I'm going to continue with the introductions, and then as we open up into more of a roundtable format, we'll be able to weave in some of the questions that have come in. So thank you very much for those that sent them in already. Next joining us is Luann Tang Young from Vaughan Community Health Center, which we also reference as VCHC as an acronym of many that we have in the community. And Luann and her team obviously are going to talk a little bit about the services they provide, both as primary care, but also from a community perspective. So welcome, Luann, and please join us.
Great. Thank you very much, Belinda. Good afternoon, everyone. I am Luann Tang Young, Director of Programs and Services at the Vaughan Community Health Center. The Vaughan Community Health Center is a not-for-profit organization. We provide primary healthcare services, chronic disease prevention and management, and personal health and wellness programs to residents in Western York Region, such as Vaughan, Richmond Hill, also in Northern York Region, such as Keswick, Georgina. Our center serves community members who are experiencing barriers in accessing healthcare services due to their culture, their language, their age, chronic illness, and the like. So starting with slide 2, so the Vaughan Community Health Center, as I said, has 2 sites. It has the main site is in Vaughan and the other site is in Keswick. All of our services are free to our clients. For those clients who do not speak English, we provide telephone and also video interpretation. Especially now during the time of COVID, we are finding that a lot of our clients are utilizing this service because due to physical distancing, they're not able to reach out to their friends or other relatives to help them with the interpretation during appointments. So this is a very used service. And also in this time of COVID, the Vaughan Community Health Center is looking at a different way of delivering services to our clients. We're learning a new way of doing business in order to remain open and also accessible to our clients. So our center has learned to become resilient, and we're reimagining ways of providing services to our clients virtually. In addition, we have acted very quickly in terms of implementing infection control and also screening processes in order to keep both our clients and staff safe. So for example, if our client is coming in for an in-person visit, and that is limited, we would be calling them at the beginning, the day before their appointment to do screening for symptoms, for COVID symptoms. And then when they arrive at our center, we actually do the screening at the door again for the COVID symptoms. And we're also asking clients to wear a mask. If they're coming with their mask, great. If not, we give each client a mask. So in primary care services, our physicians and nurse practitioners, they are conducting telephone and virtual appointments. They're also coming in. We're only inviting clients to come in only when it's essential services. They're not able to provide the services virtually. And when it comes to clients that do not have insurance, like for example, they've just arrived in Canada and they're waiting 3 months for their OHIP, we are still open to those clients. Moving on to slide 3. Chronic disease prevention and management. Now, our diabetes team has been very, very busy. They've been calling our clients to check in to make sure that their blood sugar level is okay. They're providing education in terms of the proper foods to eat in this time. And so also our clients, some of them are having difficulty, facing challenges in terms of getting access to fresh food. So we're helping them with that too. In fact, we actually have a United Way Greater Toronto grant that we've received, a small grant where we are able to deliver fresh good food boxes to our clients. Those are experiencing financial, mobility, chronic disease, etc. challenges. And we're doing this in partnership with York Region Food Network and also CHATS. Now, our chronic disease obstructive pulmonary, our chronic obstructive pulmonary disease team, COPD, they're also very busy. They're reaching out to their clients via telephone. And as you know, these COPD clients, they are at most, they're very vulnerable when it comes to contracting COVID. And if they do, there can be dire consequences. So for us, we are, of course, advising our COPD clients to stay home to practice that physical distancing. So what we're doing is that our team is reaching out to them also through Zoom, providing the exercise programs, which is very important for them to maintain healthy and active, and at the same time providing the support group. And as I said, exercise is very important to our clients with chronic illnesses. It helps them to manage stress and also to manage pain. So what we've done is we've restarted our exercise programs online. So our clients are learning how to exercise safely and also being able to do it according to their abilities at home. In addition, we have one family physician who is trained in mindfulness. And right now what she's doing is that she's providing stress management program via Zoom. Sorry, just making sure we have the same slides. Okay, personal health and wellness. So initially we had to suspend all of our in-person group programs due to physical distancing. Now we have our programs being delivered virtually through Zoom, and we're teaching our clients to use Zoom, and at the same time our staff, we're learning how to use Zoom also. Our programs focus on reducing social isolation, building supports, and personal skills development. Actually, we currently have a partner with Chats. We have the Caregiver Support Program, and Jasmine, who is on the call, is one of the staff, co-facilitating with our staff. Moving on to slide 4. So we are starting 2 programs this week, and I've included the flyers for your information. This is the Train Your Brain flyer. So the program focuses on fun games to promote brain health. Moving on to slide 5, Tell a Friend's Phone Program. So this program is for those clients who do not have access to a computer or internet, and they can reach out to others and reduce isolation via telephone. Moving on to slide 6. So we have many more virtual programs that we are delivering to our clients and also to you in the community. We invite you to visit our website for the virtual programs calendar. So in summary, as you can see, all of our organizations here that are on the call, we are doing our best. We are rethinking how we're delivering our services, reimagining how we can be accessible to you. So what we want you to know is that we're here. We're here to take care of you, to take care of your loved ones. So please reach out to us. Thank you.
Well, thank you, everybody, for sharing your introduction. I'm sure there are many people that are watching us live that might not be familiar with some of our organizations or services. At the end of the presentation, there will be a slide deck with our organizations and websites, and we invite individuals to reach out to get more information. I think that is part of the transitions, knowing about things and creating access points. Minister, the community is so important to all of us. You're very familiar, as well as many other stakeholders around the work we do. Often we might not know what's out there until we need it. And during COVID, it's definitely presented some other challenges. There are many questions that people have. It's very interesting just listening to each of you share, the own transitions that you've had internally, supporting transitions of technology and approaches to access. And I don't know if you're all hearing this, but I'm hearing this almost every single day. There will be many lessons learned and things that we might take away that will be embedded in the way forward. As Minister mentioned, it may take weeks, years, and maybe just from a point of access, it'll create those pathways. So Minister Tibollo, I just wanted to open up the floor. We have a couple of themes, and there's a few questions that have come in as well. Just would love to hear from you around what are the transitions you're hearing about, and because we really want to make this very meaningful to the community, and then open up the dialogue to some of the themes discussed so far.
Well, one of the things that this new reality has created for us is an opportunity for us to look at the systems that are delivering services. So it's been really interesting from my standpoint. We were talking about transitions or having to modernize, our education system. We had to modernize our judicial system, our healthcare system. And we were looking at things that we wanted to do as government to start that process before COVID-19 came into existence. One of the things we learned that was, really inspirational was that the sectors that are delivering services were very quick to jump in and start the transformational processes. We joined in wherever we could, and I'm not sure if you've heard these comments, but our minister, our attorney general, has commented that our judicial system has been, 15 years ahead of where we thought it would be, from the standpoint of having access now to virtual courtrooms as opposed to having to move people around. And so there's a huge change that's happened there. Our healthcare system, we've seen a huge change with telehealth and individuals being able to speak to their doctors and get supports that they need. So it's done a great deal there. And in the sector of mental health and addictions, one of the things that when I came into government, I was actually involved in the front lines when it came to addictions. I used to always comment that, accessing service is almost impossible. If you can access a service, there's always transitions between services and supports that you need to have, non-existent. There's nothing connecting the pieces. So we had a very fragmented mental health system in place. In addition to that, there were a lot of people that started organizations. Actually, I, for instance, created one of the great organizations, but why did it come into existence? It came into existence because there were not supports sufficient coming from government, and something grew organically. I think hospice may have had its start there as well in that form, but we recognize the importance of that. Likewise, the other services that are being provided by the other people that are on the panel. A lot of these services grew organically because of the need that wasn't being addressed by government. And when you have a pandemic, it forces everyone all of a sudden to really look and see what needs to be done, what is there, and what can we do to work together. I don't see, the discussions that are taking place here today, I don't see them as silos. I see them as pieces that have to be integrated into a support service on a needs basis for individuals. So this way, if Michael Tibollo comes forward and he needs some help, it doesn't matter what help he needs, but he isn't going to find it in one place. And there has to be a way for us as government to work with organizations like all of yours to find the supports that are necessary for Michael Tibollo to go through the process. We've seen, in neurodevelopmental disorders, Maria is more than familiar with this. You either end up being in the MCCSS side, so the community support service side, or you're in the health system. If you're in the health system, you get no support from the MCCSS. If you're in MCSS, you get no support from health. Individuals need all those supports. And you can't look at this from two separate viewpoints and expect to find solutions to help individuals. So my job, and one of the reasons why it got split off from health, is that mental health and addictions impacts on about 16 different ministries. And to be looking at health, or specifically physical health, mental health always ends up on the back burner, because we all know that there's a stigma associated. If you're a senior, you can't look weak, because if you look weak, it means that there's a lot of mental health implications to not being able to do the same things you could do when you were in your 20s. But there's nothing wrong with aging, and there's nothing wrong with looking and needing help when that time comes, provided the help is there for you. So we need to do more with that. And I've worked really hard over the last year to develop a mental health plan for the province of Ontario. Some of you may have seen it, the Roadmap to Wellness, the plan for the strategy for mental health and addictions for the province of Ontario. I take an approach that we need to look at the lifespan of individual and provide those supports at each stage. So whether we're talking about needs for seniors, 65 over, whether we need supports for 45 to 65-year-olds, whether we need supports for kids under the age of 12, what level of supports can we put in place? So we've come up with structured psychotherapy, which I think you may all know. It's a free service that is provided by the province of Ontario. We started with internet-based cognitive behavioral therapy. We have about 1,200, 1,300 people now registered getting online cognitive behavioral therapy. And again, this is for mild and moderate type needs. And for the more acute care, there is a way that it steps up and an individual can have face-to-face or group sessions to assist. We're doing everything we can to alleviate that stress on the system so that we don't have hallway healthcare and that emergency medicine is there for the people that need it. That entails a step care model, which all of you are aware of, that your services should be delivered on a needs basis to the individual as close as possible to where that individual resides. So there's a lot of transformative work that as minister I've been responsible for and working on. The implementation, unfortunately, with COVID has in some ways, from an access standpoint, been enhanced because I've had more time to focus on that. But there's still so much work that needs to be done. Bringing awareness of the work that, for instance, that hospice does. I mean, if you didn't know what hospice does, you wouldn't know all the programs that run out there. I mean, I had the pleasure of sitting with a group of kids that had lost parents or siblings or a parent, and sitting there and watching the work that was being done at hospice to help those kids. And we know, all of you know, that the best results we can get is to invest in our children in order to give them the tools to build resiliency and coping skills for when they get older. If it wasn't for programs like that, these kids would have trauma somewhere that would come out when they were in their teens. And again, if it's not diagnosed and it's not treated in their teens, it would be carried into their adulthood. And this is where we get things like complex PTSD and PTSD issues that, are triggered unexpectedly sometimes. So if we can address these issues and have services to support the neurodevelopmentally disorder or learning disorders, the group of people in that sector. I've worked in that sector as a volunteer. I know that the potential for individuals with those disorders is huge, but they require the space, the time, they require people to provide those supports. And some of the supports are great in school, not enough. So we've invested another $27 million, bringing our investment in schools now over $40 million to help kids with mental health have the supports they need, and the kids that have the neurodevelopmental disorders. But then they transition into adulthood. And what happens? They fall through the cracks. There aren't enough groups that are doing the work. And again, as a result of that, we've got organizations that have sprung up around the province, like Creating Alternatives, that actually are fulfilling a need because of a gap that exists in our system. What do we need to do as government? We need to look at the programs that are being run, ensure that they are evidence-based, because that gives us an ability to measure. And then we have to scale them up in the province and make the investments. And those investments mean investments in housing, because supportive housing is an important aspect. If you don't have a roof over your head, you can have food on the table, but you need a roof over your head. You need to have that sense of belonging. You need to have, you need to inspire a person and give them hope, give them the ability to feel that they're wanted and they're part of the community. So housing, supportive housing is an important aspect, and we've invested, I'm going to have to be corrected on this, somewhere in the range of $20 to $30 million, and there's additional investments coming. They would have come out with the budget, but they will be coming out in the fall with our statement that there'll be investments to further assist in supportive housing. We need to have programs that are, again, evidence-based and are, showing results, because we know that an individual can have a more fulfilling life having those supports in place. So there's a lot of things that we need to do. I don't want to turn this political, but I came to government not because I was looking for a new job. As you can see, I'm not a young guy kind of like looking to build a career. I came to government because I spent 10 years in the trenches doing what a lot of you are doing, looking for ways to help people. And every time you ask for help, you're given 100 reasons why you're not going to receive it. And if you are going to receive it, it's usually because of somebody just being tired of listening to you. That's not how you build a system that works. You build a system that works by looking at what the organizations are doing. You don't try to amalgamate organizations to build efficiencies, because that's another thing that I was told we needed to do, and I disagree with that. I think what we need to do is look at grassroots organizations in the community that are delivering services, doing an exemplary job, but are doing it on their own dimes because they have never gotten to the opportunity to speak to someone like me in government. I will advocate for these groups, because these are the groups that we know are doing the job, delivering the services at the grassroots level, and we need to do more to support them and scale them up so that we have these opportunities for everyone, whether you're Indigenous, Francophone, LGBTQ2, whatever it happens to be that is who you are. We need to support you. As a government, no one should stand at the sideline or not be given every opportunity to fulfill their lives to the fullest. And that's the approach that I take to the work that I do. My background, as I said, was in addictions, and my studies right now, I'm doing my doctorate in clinical psychology, just about finished chapter 1. But the work that I'm doing in my doctorate is focused specifically on recidivism rates to make sure that what we put in place when it comes to addictions and concurrent disorders is going to give us the results for those individuals and be funded by government, as opposed to people scrambling to try to find money to help their kid, their child with complicated issues. I talk too much. I'm going to turn it back to you, and we'll have some. I'll let everybody else speak. I'm sorry. I'm going to keep quiet now.
No, these are really important conversations, Minister. We call this town hall on purpose transitions. And there are many nuggets that I have to just encapsulate based on some of the questions that are coming in, and based on some of the dialogue that we can continue over the next short while. There's a term called compassionate communities. This is not a new concept. This is about people taking care of people, and absolutely correct around the grassroots natures of many incredible charitable causes, the faith communities, the neighborhood approach, generational families close and far. And it's really an important thing that we try to leverage, because that helps with transitions. And the other thing that kind of stands out for me around the mental health is health campaign that you've been echoing for many years now is just around the feelings. I have to say, on a personal level, there is no one that I'm not talking to that isn't talking about how COVID is affecting them, anxiety and worry. There's not anyone. It already existed, and maybe that's because of what I do, but on a personal level, everyone in my work, in my work family, in my community, everyone is talking about feelings. Wendy, feelings are complicated, and people sometimes don't know how to kind of resolve that and what's normal or what's not normal, because maybe they haven't necessarily gone down that pathway. I'm not a clinician, but talk with us a little bit. COVID feelings, non-COVID feelings, like there's a lot happening that affects both individuals who are maybe aging or ill, or family members. Talk a little bit about that, please, because the questions are coming in around that, and I think that it would be a great way to kind of launch our open forum.
You're so right, Belinda. There are the whole leveling factor is our feelings, and the dynamic feelings we're having right now, because we are in so much of a transitional period. And with transitions, transitions are change. With all change, there's loss. When you deal with loss, you need time to accept the loss, to work through the loss. Even if if the change is wanted, there is still loss. But if the change is not wanted, that process takes even longer. And here we are in transitions, not only in one aspect of our life, but because of the pandemic, we have to transition in all aspects of our life. All of our roles, our rituals, the things that we base ourselves on, things that are very important to us. For me personally, I love to go to the gym 3-4 times a week. And that is a big stress reliever. As a psychotherapist, I needed that. I've lost that. I've lost having my family close to me. I've lost all the things that ground me. And if I'm going through this, I can just imagine what others are going through. Combine that with that feeling of social isolation, and then you have nothing to ground yourself from your anxiety, which is long-term, our unknownness about what's happening in society. And it's global. It's not just this one area that we could travel out of and be in a normal spot again. It's everywhere. So with this global stage, with this long-term anxiety, and with this loss of certainty and familiar connections, we're all struggling with, where do I find my resiliency? Where do I find this? How do we manage? And as we've all echoed, as different agencies reaching out, but even that's not easy. It's hard to do because it almost is the antithesis of the independence we pride ourselves on. So knowing that other agencies are there, knowing that we can connect and share that compassion with each other, create that compassionate community that we can, face to face, share that load of helping each other. It makes it so much easier just to know that others are out there. The feelings are normal. It's part of that process of change. And you really need to understand and give yourself that space to process it in the time frame you need to.
Yeah, yes, thank you, Wendy. And I think about like all these volunteers, see things on the news and you see things within our organizations, these compassionate citizens and community friends that are going out and just doing touch points with people. If it's talk a little bit about what you're seeing, not just internally, but externally, like how are these communities like kind of reaching out to one another, because it's happening.
Mm-hmm. Mm-hmm. Oh, all of our agencies. Maria, you were kind enough to share some of the drop-offs that your volunteers are doing. We also did a complimentary art wellness package there with stress balls. We dropped those off to some of our families, and they really enjoyed not only doing the mandalas, but also having the connection, seeing a face that cared. And part of resiliency is not just knowing when to reach out for your own help. It's also knowing to reach out to help someone else, because that's where your hope comes in. That's when your bottom line of, I may not be okay, but I can make somebody else okay. And that begins to grow that foundation of resiliency.
For sure. And Jasmine, I think about the seniors and all the individuals and chats, and we've had a couple of comments coming in through email at info@hospicevaughan.com. And it's interesting, the seniors are saying it's difficult for them, and it's hard to make those connections, and they might be virtual or non-virtual friendly kind of in their tools that they have. And they've been shut in, like they use the term shut in. One of the questions came in, I've been shut in since mid-March, what do I do? Where do I turn to? Like it feels so different for them. And I just wonder if you could talk a little bit about, that support to the seniors and what does that look like? Because you must be seeing it every single day.
Yes, so I want to talk first about the check-in thing with what Wendy said, knowing how other people may be dealing with it differently, whether it be seniors or people who are more prone to being around people, so they thrive off of being around people's energies, and now having to be cooped up and staying at home and not being able to connect with others the way that we're so used to. It really has a long-term effect on us. And to be mindful that when you are avoiding these difficult conversations with yourself or with your family, with your community, you may be trading short-term problems with a long-term dysfunction. So being mindful of where you're at, and understanding that it's okay to feel this way. It's normal. It's part of the transition period where we're going from understanding this is our new normal, how everyone talks about, to understanding that there are supports available out there that can help us feel a little bit more grounded and more socialized. That's the first step. So we talk about staying in contact all the time, whether it be virtually or having curbside visits with your family. Grandkids calling is always a great thing as well. Having the family deliver flowers or your favorite takeout to your front doorstep. We also encourage clients, specifically talking about caregivers who are caring for their older adults, or if you know of a friend who may be dealing with it a little bit more worse off than others, setting up different ways of staying connected, such as bingo online, There's card games online that you can do. There's senior exercise classes. Looking up your local senior center or community center or faith organization and see what their virtual online scheduling is like. There's also like chess games as well and card games online. The prepared meal deliveries, such as Meals on Wheels or the local Love Food Box, those are for people who are able to still prepare their own meals. They have ingredients for you to do so. There is other ways of also making it easier to stay home, such as having managing medication with medication reminders, a pill organizer box, automated medication dispensers, and a big thing as well to keep for your sanity as well as your family is planning for medical emergencies using life alert bracelets or pendants with the GPS tracking. You can also have the sensors that detect a lack of motion, so it alerts caregivers if there's nobody in the home for a long period of time or in certain areas of the room. Smart technology is also really great. There's the Amazon Echo, there's Google Home, smart thermostats, smart lights, you have smart home security systems, key and phone wallet finders, all these things that help make your life a little bit easier for your loved ones or for yourself as well. And if it's also about a matter of staying home safely, we have the home maintenance and adaptation program, part of CHATS, where you can install grab bars in your shower, as well as free toilet seats, shower chairs, motion sensor taps, things like that. So there's ways to stay connected. There's ways to stay healthy and live independently at home as long as possible. It's just about first being aware of these services and then calling us or calling a friend and letting them know what's out there.
For sure, Jasmine, thank you so much. It's important, and you never know when you need these things until you need them sometimes. So it's a bit of a process of learning for all of us. Maria, one of the questions came in and really ties perfectly to creating alternatives. You know, a lot of people have been finding it very difficult because of programs that support those living with disabilities, for instance, like yourselves. They've not been able to be on site, and it's difficult. And they're asking questions: when will they open, and how will that look, and how will safety precautions? And that's kind of, I think, across the board, right? And I think the medical officer is providing information. We're looking at, you know, best practices and information that's being provided by public health. You know, and we're taking it a step at a time, and we want to be really cautious because, you know, we're taking COVID-19 very seriously, both for our community and for ourselves, and we want to keep people safe. There's a lot of people that are finding it just very difficult, and they're really, really isolated. And I think sharing kind of those stories and examples will help people know they're not alone. So it'd be great if you could talk and kind of just answer like some of the themes that are coming in. The questions are kind of in that kind of realm, and talk a little bit about the supports. And I know there's other organizations that maybe have enhanced supports, but what does that look like? Maria, you're muted. Just it's okay.
Sorry.
No, not
Thanks,
at all.
Belinda.
Not a problem. I started it off that way, so I'm glad I'm not the only one. See? Transitions.
See, I'm learning. I want to start off by saying that we are so fortunate. I'm so fortunate to work for an organization like Alternatives that is dedicated, invested, and committed to supporting anybody. Right now we are supporting everybody, not just people with disabilities. On March 16th, when we lost the life that we knew, we lost the freedom, we just sat there. And, you know, for the first couple of weeks, it was like watching a reality TV show. Nobody could believe what was happening. I mean, we had seen starting in January what was happening worldwide. Maybe we were naive to think that it wouldn't happen to us in Canada, Vaughan, Woodbridge, wherever you are, but it did. And after the initial shock and the fear, we had to figure out what it is that we were going to do. So first and foremost, our organization wanted to make sure that it took care of its staff. We were so fortunate that we had a board and an agency that was committed to supporting their staff. We sat down and we recognized that we are a person-centered program and we always look at the individual first. So we wanted to make sure that what we were communicating to not only the families and the participants, we were modeling. So when we made the difficult decision to close, we wanted to show our participants that staff were staying home too, and staff were confused, and staff didn't like it just as much as they didn't like it. So by going virtual, through the virtual, like through the Zoom platform, they could see that staff were at home. We take a few minutes at the beginning of each class to talk about our feelings, sort of touch base. It's okay to have a meltdown every once in a while. We can't sweep it under the rug. But we also had to take into account the families that don't have technology and how would we continue to support them. So it was, whether it was contacting them via telephone, whether it was driving by and just dropping off like an ice cream, like I had said earlier, it was just to show them that alternatives, just because public health requested that all programs close, that didn't mean that we stopped caring. We didn't stop caring. We want to make a difference, regardless if we're getting a paycheck or we're getting funding. We are committed to the cause now more than ever. It was amazing to see how lucky we are that we have not only a community, but we have leaders that are united, regardless of whether you're liberal, conservative. We are all working together. The leadership is amazing, and that's what we too want to do. Is our leaders are representing and leading us, and we want to lead. We want to lead the disenfranchised. So we think it's really important to continue in supporting. We're looking at our reopening. We don't know what reopening is, but we've talked about, okay, whatever the guidelines are, we will make sure that we abide by them. We are trying to think proactively, ensuring that we have enough PPAs and stockpile them, whether it be for a couple of months, because once the reopening starts, I'm sure everybody's going to be looking for those PPEs. Making sure that transportation isn't a barrier. We have people who rely on mobility, Wheel-Trans. What is that going to look like? Our ratios may have to decrease. We don't know when we will open, but what we do know is that we are committed to supporting the people, the families, and that together, we're going to be okay. We are definitely going to be okay, and we're going to pivot. And I always say when I do my intake interviews that we at Alternatives are very great. Life is not about black and white. We need to learn how to adjust and sort of go on the fly. And that's what COVID has taught us. COVID has taught us that we need to not take anything for granted, that things, I'm 49 years old and I've never had to worry about war and hunger and famine and isolation but COVID has now taken away our freedoms. We were sort of like self-isolating and social distancing. So now we are looking at it. Okay, we've gone through it. We can see the light at the end of the tunnel. The important thing is that we follow the recommendation set by the people who know, and together we can do this.
Absolutely.
Maria, can I ask you a question?
Yes.
Belinda, if that's okay. One of the things that we always read about, or I've been told anyways, is that when you're dealing with someone that has a neurodevelopmental disorder, the individual needs to have that routine. Disrupting the routine ends up causing the individual to regress. So what, if anything, can you do in this environment where we don't have that physical contact or the ability to continue with the routine? What types of things? I know you mentioned some things about, going and paying a visit.
Can you hear me?
Yeah, go ahead, Maria. Yeah, I think
Okay.
he'll come back. This is
Okay.
technology.
Okay, I wasn't sure if it was me. Okay, so,
Yeah, so
it's
Maria,
true.
we're down to 10 minutes. So maybe if you can speak to that, because we have a few other areas, but it's a very important piece around routine.
Yeah, for the individuals we support, routine is so important. It's like we need breath and air, they need routine and structure. We first start by telling them that things will be okay. We need to address the issue. We can't sweep it under the rug, right? We think it's super important that we continue with learning and try to encourage new ways of learning. With learning comes growth. If you don't continue to grow, you regress. With time, our participants over the past 2.5 months, although they don't like it, we've kept the conversation, and we have basically told them it's okay for them to feel that way, and it's normal that we're feeling that way too. But these are some strategies that we can do right now to help. And we're finding that through conversation, they're beginning to adjust to this new norm, willing to maybe not accept it, but sort of like live with it just for a little while.
Well, Maria, they say it takes 21 days to new habits, right? In general, and I'm sure those living with disabilities and caregivers and seniors and many other individuals, all of us, like we're all trying to figure that out. But I think the essence of what you're saying is you keep those lines of communication open, you show it, you live it, you breathe it, and you have that spirit of continuity that continues to grow. And hopefully Minister Tibollo will get back online. This is sometimes how technology goes, but we'll continue onwards. So we're down to not too much more time, but Luann, you already spoke, and I know it's going to be brief, but you talked a lot about those that may not speak English or those that might be marginalized and so forth. And Minister Tibollo made me think through, it was something that someone told me a few months ago. Everyone needs a safe place to live. Everyone needs some food, and everyone needs a friend or someone. And it's, maybe sometimes so simple, but it's so honest, right? Talk a little, just to share with us around, that population that sometimes is invisible or people don't even know. And what words of inspiration and hope would you say to that group?
Okay, so for those populations that are, may feel that they're not able to speak out because of language barrier or culture, etc., I think it's important that they can reach out to us. We actually have system navigation case managers, and they can, just to find out what are the issues or they're dealing with, and we can help to link them with our resources that are internally. And if we're not able to find those resources, we can definitely help them to find resources externally. And the good thing about our system navigation case managers is that they can help our clients complete whatever forms that's required, right? Because sometimes language is an issue, or even understanding the process of navigating through the system, etc. So we have that. They're part of our PACT, People Accessing Care teams. And then also, I think the part where people are not aware of is that we also have allied health services. So people can access like chiropodist or foot care for free through us, physiotherapy. They can access, physiotherapy, and also mental health counseling for sure. We are seeing, as I think members have already mentioned, an increase in terms of mental health counseling. So what we're doing right now is that initially we are providing these services through the phone, but with the reopening of Ontario Phase 1, our center is slowly reimagining, thinking how we can provide in-person mental health counseling, foot care, and physiotherapy on site, and figuring out how to do it in a safe way for both our clients and also our staff. Because these services, it's hard to keep that physical distance. So right now we're working on that, and I think eventually we're going to start to open up and provide these services 1 day a week for each of these areas.
That's great. Definitely reaching out and inquiring is so important.
Yes, please do.
I just want to give a little shout out. I know we couldn't represent all the community health and social service partners, but our partners at Yellow Brick House Residential Shelter, which is the shelter that covers all of York Region, they continue to remain open and COVID-free. For those that might be suffering from violence and in need, please reach out to them. Their crisis support line is 24/7. I'll repeat the number twice. It's 1-800-263-3247. Again, I'll repeat, it's 1-800-263-3247. And I always say this wrong, but sometimes people don't know where to turn, and I think it's 211. Is it 211, Jasmine? So 211 is a great place if you're not sure of if you're needing a resource and you're not sure where to turn. You can always give them a call. Jasmine, I don't know if you have anything you want to share around 211, but it's a helpful resource for many people, and people may not be aware of it or remember.
Yeah, and not only 211, but there's other mental health supports. There's the Big White Wall. There's the 24/7 mental health 310 COPE. You can always also contact CMHA for the Bounce Back program. There is also a coronavirus anxiety handbook from the Wellness Society that's really helpful. And always feel free to talk to your doctor, reach out to a friend, or even journaling. I found helps a lot of people to put their feelings and emotions on paper, and it helps kind of separate the two.
That's right. And hopefully there's a slide that shows some of the services that Minister Tibollo often speaks to, that includes youth hotlines like Kids Help Phone and some other service providers. We definitely want people to know that these things exist and to reach out. So because our time is coming short, I'm going to really hold you to just a short comment. I want you to think about the word resiliency. If you had to say just a quick sentence on resiliency, what would it be? And I'm going to go backwards. I'm going to start with you, Luann, first.
Sure.
And then we'll go around the panel.
Okay.
Resiliency.
Resiliency. To me, that means that being able to, first of all, look inside and see what is it that you need, be able to identify and be aware of what it is that you need, and then reaching out, not being afraid to say, I don't know what I'm doing, I need help. That to me is resiliency. And then if I may capture what Wendy said, I think the other part of resiliency that I believe in is also not only being able to help yourself, but looking to see how you can help others. Because I think by being able to help others, I totally agree with what Wendy said. It gives the person hope. It just certainly gives me hope.
For sure. And Maria, she's muted. So less than 30 seconds each.
Resiliency means to never give up, and you are not alone. And together we can get through anything.
Jasmine, please. Resiliency.
I would say that resiliency isn't about coming out of anything unscathed or untouched or invincible. It's more so coming out of it the other side, learning and adapting and really transforming. So it's not about that nothing affects you. It's honestly about being affected and working through that wave and finding yourself again.
Mm-hmm.
And Wendy.
Wow. Resiliency is not magic. We all have it. We can all enhance it. We can all work on it and grow it. But it is a process. And you need to be kind to yourself. You need to be gentle with yourself. And you need to give yourself time to work that process.
Minister Tibollo, welcome back. Yeah, I'll give you a minute and then I'll do a quick wrap up and thank you. Please, resiliency. Any final thoughts?
Well, resiliency is something that we need to learn. I believe that intrinsic motivation, learning things like hope, love, respect, the basic things that we should all hold as a value system for ourselves, is what helps us build coping skills and helps us build resiliency. And it all starts with believing in yourself and acknowledging the fact that these are, skills that need to be learned, they need to be practiced, and that we can overcome anything if we put our minds to it, because our minds are much more powerful even than our bodies. So we need to learn how to use that amazing machine that we have that processes this information and provides us with the strength to make everything else in our world work. So that's resiliency for me.
That's wonderful. Thank you all. There is so much more. I think we all would agree that we could continue the discussion. And I hope this isn't the end of any of these discussions. I hope they continue on in your homes and within your families and your support networks. Reach out to agencies such as those that are participating. The government and the leadership is listening clearly, and they're here to support you. There are so many people to thank. I want to make a special remark of thanks to Mayor Bevilacqua for sharing his comments with us today. It means a lot to all of us. You support us in many different ways every day. For those that haven't been able to join us, we know that you're out there providing support, health community partners. And a special thank you to Render Media and Mike and his team for helping us to put together the first ever community town hall of this kind. And we hope to have opportunities to come back together, to have other discussions to come, and just reach out to us. Minister Tibollo, you're fearless, you're devoted, you listen to the community. We're very grateful for your leadership and support. And Vaughan, and I sincerely want to thank you and your team for helping us come together today, and sincerely want to wish everyone to continue being safe and healthy and reach out for support. And the last word is yours.
Thank you. And I just want to echo what you've said. Thank you to everyone that participated. Thank you for the amazing work you all do. You are all frontline people that are there because you believe in what you do. The work that you do is not a job, it's a vocation. You do this job because you truly care about people. And that to me is something that's extremely important. And I want to make sure that it's acknowledged, it's recognized, it's celebrated, because vocation is what's going to make a difference in this world. When people do things beyond the pay grade that they get for the job they do, it's that extra little bit that they do that gives us the ability to to make a difference in the world. And you're all making an incredible difference. God bless you all. Please stay safe, and you can access me anytime you want. My number, my email is readily available. Anything that I can do to help you in the work that you all do, I'm more than happy to be part of it, because that is why I'm here, is to help you make that difference on the front lines. So thank you all.